Hi, my name is Chien-Chi Huang, and I'm a community program manager from Boston, Massachusetts, and a breast cancer survivor. I decided to join the network because I strongly believe in its mission and its vision. I hope by sharing my story, I can get others to pay attention to their breast health and see that breast cancer is treatable and that help is available in the community. My cancer journey started in 2005. A few months after I turned 40, I feel a sunburn sensation on my face while I was at my son's soccer practice. Later, I had rash on my face and my fingers were red and swollen with papules and crusts in my cuticles. The dermatologist did the blood test and ruled out lupus and other skin problems. He gave me some topical ointment, but it did nothing to alleviate the situation. I was very sick with flu-like symptoms, and then I feel the hard lump under my arm. I called my doctor, and after her examined me, she called for a needle biopsy right away. I knew things were not looking good when she called my husband and suggested that he came along to the appointment. When the doctor said I had breast cancer, I was in total shock. I had no idea that what I had could lead to cancer. I thought breast cancer could only happen to white people and old people. I decided to have a second opinion, but it confirmed the results. Finally, my survival instinct kicked in, and I thought to myself, I had to beat this thing, otherwise my kids would grow up without a mother. I was fortunate to have Dr. Ling, a Taiwanese oncologist, to be my doctor. The fact that we can communicate in my native language is very comforting, and most of all, I know that she will take care of me as a person, not just treating the symptoms. This is very important for all cancer patients when you choose your doctor. Because I have a more aggressive type of breast cancer, Dr. Ling suggested I have chemo first to shrink the tumor, then a mastectomy followed by a radiation. I did not have much discomfort when I started chemo, but it freaked my kids out when they found hairs in their food. So I took a proactive approach and shaved my head with a friend by my side. I did not think I would cry because I was very emotional when it actually happened. It was as if I were saying goodbye to myself. When the words got out that I had cancer, people reacted differently. I had strangers offer me help and support, and some friends distanced themselves after they learned the news. It was awkward at first, but I learned to tell it as it is. My in-law decided to move in with me to help care for my kids who were 8 and 5 at the time. It was hard to give up the role as the caregiver. I remember one time, my son asked me to make a PB&J for him. And I stood there for a long time, not knowing what to do first, because the drug has impaired my cognitive behaviors. I have to say that the scariest thing happened to me was not about losing my hair or my breast or my life, but it was about losing my mind. I was on prednisone, a very powerful drug, and I was not aware how the side effects would have an impact on me and my family. I was like a computer that was on all the time, and I couldn't shut myself off. I had very little sleep, and I thought that I had the ability to figure out. I thought I had the ability to figure out how to solve the Middle East crisis and why the Democrats lost the election. I became moody and paranoia. At one point, I even suspect my husband and my in-laws were trying to cut me off from the outside world, and they were in conspiracy to kill me. And I didn't want my husband to be on my proxy. Now that I look back, I wish someone would have warm me and prepare my family for the hardship. When I was in treatment, I went to the support group at a wellness center. It helped to see other survivors, but I was always the only Asian there. I was surprised to learn later that few Asian American women I knew had breast cancer before me, but no one talked about it. I know that many people out there are still suffering in silence, and that stigma, shame, and misinformation prevent people from seeking treatment and support. My own aunt, who emigrated from Taiwan to Hawaii, died of breast cancer because she was afraid of losing her breast and she refused surgery. I wanted to change, and so I'm here, ready to serve and hoping to learn from the other members how to empower and advocate on behalf of cancer survivors. So if you are watching this video, please forward this link, this video, to your loved ones and take time to learn how to do breast self-exam. And if you don't know how, have your doctor to do a clinical exam for you. Be informed. Find out if you're in high-risk group and schedule your mammogram on a regular basis. Finally, please check out the website of the network and be part of the movement. You can make a difference and contribute however and whenever you can. Thank you for watching, and I hope you will join us.